Hello and welcome to College TV. Today we're at the Royal Australian College of General Practitioners in South Melbourne. We're here as councillors from our college visit the model eHealth community, which is being presented by the National eHealth Transition Authority, or NETA, and the RACGP.
Something new which is called the IHI, individual healthcare identifier that each person has. Now, it's not a number that we're going to need to carry around, not like a Medicare card in our pocket or a driver's licence or anything like that, but it's the linchpin to put all pieces of information together.
The model eHealth community provides a first-hand demonstration of how the new Healthcare Identifiers service will work. The Healthcare Identifiers service is a key component of the government's eHealth initiative. It all gets underway in July of this year with the commencement of the personally controlled electronic health records. Councillors from the college are here today to learn how all of this will work in practice.
And we're going to send a referral, and you can see it's got here, my name is the GP here, address, my individual provider number, so you would know whether Gary Friedman's referred it from the Western Hospital or whether I've referred it from my rooms. When we send it electronically, and Siobhan's going to send it now, and she's sending it via ReferralNet, which is one of the many programs. She's sending it, she'll get an acknowledgement that it's been received.
One of the fellows close to the eHealth action is Mr. Gary Friedman. Gary is a Melbourne-based vascular surgeon, a NETA clinical lead, and the convener of the eHealth program at the forthcoming ASC in Kuala Lumpur. Gary is also a very keen advocate of eHealth, believing it can serve as a tool to achieve greater efficiency and profitability in surgical practice. Thanks for joining us, Gary. Tell us about that.
Okay, look, thank you for the opportunity to tell fellows about the advantages of eHealth. For example, I send about 75 to 80% of my specialist letters out to the GPs electronically. They're very keen to receive these, as they don't have to scan in multiple letters. There's also the feedback loop that if the patient doesn't get, the letter doesn't arrive, I know about it, and my practice staff can find out and make sure the GP gets the letter. So that's very important. We've also found that this saves a considerable sum of money on postage from what I was spending 5 years ago. So there's a win for me, there's a win for the GP, there's a win for my staff, and there's also a win for the patient in that we've got a rapid fire communication tool where I know with great certainty that the information that I need from the GP or the GP needs from me can be given to each other in a safe, efficient and reliable manner.
And Gary, what can we expect in the eHealth space at the forthcoming ASC?
Okay, what we're going to try to do for surgeons at the college ASC in Kuala Lumpur is give them a pot shot of what is happening in this field, what's available and what is planned. And we're also going to have a session that I'm going to be talking about where I'm going to discuss the profitability and the advance and the help that you can achieve by using electronic records. I'll also be doing a live demonstration on telehealth and speaking to the gate, because the government have brought in very generous and lucrative advances and help for us to use telehealth, and I think that it's something that we're probably still underutilising, particularly if we have a rural and regional patient base. This can help considerably your patients and yourself to look after these patients that are a long way away. So we'll move over here, and the patient's been sent home with Panadine Fort, and it looks like a normal script, but it also has a barcode down the bottom. This is going to really knock the hell out of forged prescriptions. Okay?
Another subject of interest to the college is how to encourage the adoption of eHealth by surgeons. The college recently called on government to provide a specialist practice incentive payment, similar to a payment that's been made for some time to GPs. The chairman of the college's eHealth reference group is Professor Julian Smith. He joins us now to discuss this. Julian, why do we need a specialist practice incentive payment?
It was apparent as the result of a survey by McKinsey Corporation in 2011 that surgeons were the least well prepared to adopt the eHealth technologies. Many surgeons have computers in their practices but make little use other than for appointments or billing purposes. The eHealth technology offers a great opportunity to improve patient care and communication between healthcare professionals. Unfortunately, many surgeons do not have the equipment in their offices or practices to make full use of the eHealth capability. And the college is calling on government to provide some practice incentive payment to allow surgeons to adopt the eHealth technology.
Thanks, Julian. Well, that brings to an end this introduction to eHealth. We do hope you found it informative.